What I'm going to cover this afternoon are just a couple case examples that I've been able to apply my PhD in sort of a practice setting. So part of this program here for this afternoon is to stress lifelong learning, and I guess in my short period of time here, this has been my path on lifelong learning. Hopefully this continues over time. I did go to Wisconsin for a really short period of time, but through and through past that, I am a Minnesota Gopher. So DVM 2009 from Minnesota, and then I completed my PhD in 2013. And then as Jeremy said, currently I'm a research coordinator and staff veterinarian with Holden Farms. Wonderful company to work with, just based south of the Twin Cities here in Northfield, Minnesota. I get this question a lot, so I guess I can't have, with PhD in the title, I have to have a little philosophy in this presentation. So I just put this up here I get the question, why PhD? And I took this from the University of Minnesota VMed graduate program mission, and I'm guessing most are pretty similar to this. The main reason for me was kind of the top point up here is experimental design and analytical methods. I saw the value of this, and it was something that of great interest to me. So one of the reasons I went further to obtain a PhD. But you can see the list here, some wonderful qualities, and I'd say through the program, these were things that I certainly developed and I use on a daily basis. I'm not going to be able to obviously use examples of all these today, but just wanted to put that list out there. My PhD was on influenza virus, so I couldn't have this presentation today without a little bit of influenza, so I'll cover two different topics today. The first one will be influenza A virus. My research work mainly focused on the transmission and control of influenza virus in pig populations. One of the major points that I tried to cover in my thesis was the role of weaning age pigs, and what we showed is they're really important for influenza virus transmission and can serve as a great population in terms of surveillance. This was part of one of the chapters of my PhD thesis, so we had a group of over 50 sow farms that were sampled on a monthly basis for 6 months, and over that period of time, we had approximately 48%, close to half of the sow farms, tested positive for influenza virus in weaning age pigs during that study period, so really pointing towards that fact of a great population to sample, and they're really important for flu transmission. So now in a production system role, kind of have to go, what are some of the more important things regarding influenza in a production system? The system I work with, a lot of multi-sourcing of pigs into nurseries. Therefore, influenza becomes very important. It's very likely when we mix sow farms together that at least one of those sow farms is influenza virus positive. So clinically a very important pathogen to us, and can lead to a difficulty in starting pigs in the nursery. So what we've done is taken a focus right now. Kind of the first step is to take that focus on looking at weaning age pigs to assess what our prevalence is across the system, and maybe there's areas that we can have specific focus and take some action. We're currently part of the Swine Health Monitoring Project for influenza. This is, right now it's a pilot initiative. Monty did ask me to kind of put a plug in that they want to make this a little bigger than a pilot, so if anyone is interested on influenza and want to be part of that health monitoring project, contact Monty on that. So just to give you a few things that we've learned so far, we're really early into this project with the University of Minnesota. We have had, at Holden's, there's been some active surveillance along the way. You can see kind of this spike here now in the number of farms that we are sampling that are part of that project. So our first month actually was August, where we had close to full participation. In the kind of darker blue is the number of positive herds, and lighter blue, number of negative herds. And you can see, varying from month to month, we can have fairly high prevalence at the sow farm level. Here in April and May, we were close to 80-90%. Here in August, we were about 30% of the farms tested flu positive. We're able to, just took the farm names off here on the left, but we're also able to look at, if you go across, that's one farm, so some of these are just starting to be enrolled in this program. So on a monthly basis, we'll have our flu results by subtype sequence for every one of the farms. So really giving us a really good gauge at what types of viruses we have in all of our farms, and therefore likely in most of our grow-finish production. One interesting thing you'll see here that we also saw in some of my PhD work is we do have these farms that month after month continually test positive for influenza virus, same subtypes, same sequences. So it's kind of interesting there, and we'll learn more along there as we go. One thing that we're going to be able to hopefully use this for here in the future is to better our control measures. One thing we've noticed so far, so these would be our H1 types that we've picked up here just recently, and what we found is that they do tend to cluster. So right now we basically have just 2 main H1 types within our sow farms. So that really helps us know. Before it seemed like kind of a battle. We have no idea what viruses we have. We probably have many, many different types, but this has kind of made things a little more reassuring that we have a lot of likely types within these different sow farms. So that'll help us in terms of control. So summary there in influenza viruses, we're using our weaning age pigs as our surveillance population. The goal going forward is we're hopefully going to be able to use this better data here at each specific sow farm to match our vaccination approaches and hopefully improve performance and grow finish at the system level. I think, Jeremy, you had in the email I was supposed to maybe have an answer to influenza or have it solved or something like that. So I don't have it quite that far, but hopefully here in the next few years we'll have a lot more data. The second part that I wanted to cover today was more of experimental design. I'm going to talk a little bit about vaccine trials. So I've had the opportunity to be involved in a lot of different types of studies as part of Holden Farms, and one that I wanted to talk about today was how to do different types of vaccine trials. So oftentimes we have the question of, we have multiple types of vaccines or products. Is product A better, product B, or is nothing better? So I kind of wanted to go through an example of how we can answer some of these questions. Really the options that we have, I listed 6 there. There's probably many more than that. One is we can do nothing. We just kind of go with whatever we think, don't really look into it. That wouldn't be putting science into practice, so number 1's not a great option. 2, we have published literature, CE meetings. Those can be a start. We can use closeout data. There's a lot of things you can think of in terms of disease exposures and status where maybe closeout data won't be the best for some of these questions. And then lastly, we have small scale facilities, larger scale research facilities, which I think are becoming more commonplace in systems now. And then last, we can use large scale field trials, as I'll call them. And that's the example that I want to go through today. Holden Farms has taken a really big commitment to research, and one of the reasons I really enjoy working with them. They have multiple research facilities that I have the opportunity to be involved with, and I get to work with a lot of great people along the way in those research trials. So lots of collaboration, which is really enjoyable. I'm going to use PCV2 as an example. There's not a lot of PCV2 on the agenda today, so we'll mix things up a little bit. So this is an example of how we tried to answer the question for PCV2 vaccination. As many of you know, PCV2, ubiquitous, it's kind of more of a difficult one to assess its impact. There are many cofactors that have a significant role, as we know, in the development of PCV-AD. In general, that clinical impact that we've seen in past years is pretty evident, but one question might be is what is the subclinical impact, and that can be a harder thing to assess in a field situation. And then the last question for us is can we assess vaccines for PCV2, and what are the best ways to do that? We have a great research site. Is that the best place to do it in one research site? And I'm going to show you what we went through here and why that maybe, in this case, isn't the best answer. So the approach that we've taken to answer this question and many other vaccine questions or these types of questions in the field is these larger scale field trials. So what we'll do is at the sow farm level, we'll begin there and we'll allot treatments within litter by gender. So within each litter at the sow farm, we'll assign pigs to differing treatments. We'll then wean those pigs into a nursery, and within our nursery setting, we'll mix those treatments within pen. So now we have no issues in terms of a barn effect, a pen effect. Everything is mixed together in that specific pen. And then the same if they move to a finisher, if it's nursery to finish, we'll mix treatments within finishing pen as well. So in this specific example that I'm going to give here, we've done 2 different trials. The first one we used 5 cohorts. So similar to this, we followed five different groups through 5 different nurseries, 5 different finishers. In the second trial, we used 7 cohorts that we followed through. So here's just an example of what we do. Trial 1, we happened to, based on the number of treatments we had in that trial, we had about 1,000 pigs on test per site. For purposes of this presentation here today, I just kind of combined everything together. So I'll show a few results later, but I'll just compare PCV2 vaccine versus control. So we had controls that were not vaccinated for PCV2 in this study. We then weigh these pigs individually at multiple time points throughout nursery and finish, and of course at allotment. And then we're also able to measure mortality. One thing we do miss here is feed efficiency. We're not able to assess feed efficiency in this type of a situation. Trial 2, very similar. We had fewer treatments in this case, so fewer pigs on test per site, but we have more sites in this case. We used 7 different cohorts as we followed these pigs through nursery and finish. Again, similar, weighed them at multiple time points and then able to assess mortality. You may ask, how do we get all people to collect all these individual weights? It takes forever. It's hard to convince people to do that. We've taken some approaches to kind of make this a little easier for people to do. One thing we have done is when we do tag these pigs for this type of study on individual weights is we'll use barcoded tags. You could also use RFID tags. Where in this case you just scan the tag, it goes directly into the computer, you type your weight in, and when you're done for the day you have all your weights already entered. You don't have to worry when you go back home that you have to interpret 1,000 different individual animal IDs and that you're missing 50 of them. So this has helped us out a lot in these types of studies and has made things a lot more efficient. So here's just an example. I'm just going to show a couple slides on results from these and why I think these types of studies to conduct are very important. What I'm just going to show here, I have average weight. This was one of our final weights, and I have our different sites down here. So this is trial 1, site 1, site 2, 3, 4, and 5. For this study in particular, we did also do some diagnostic testing to say what are some of the exposures that we've had on these sites. In this case, tested for PCV2, and one of what we thought to be one of the major cofactors is PRRS virus in our system. So I have no vaccine. These pigs would not have been vaccinated with a PCV2 vaccine compared to groups that were vaccinated with various PCV2 vaccines. I didn't separate those out. There weren't huge differences between those groups, so it really wasn't important for this presentation. Two important points I wanted to get across from this type of trial is, number one, we do see in this case what the subclinical impact of PCV2 can be. So we did not see overt clinical signs of PCV-AD in this case, but as you can see from the chart here, most of our non-vaccinated pigs, as we would expect, had a reduction in performance and higher mortality compared to vaccinated pigs. However, one thing we did see, what we saw just one site in this case, is that it would depend, your interpretation of this study would depend on which site you looked at. So if we just conducted this study in this site right here in the middle, our interpretation of the data might be a little different than if we would have interpreted the data across these other 4 sites. I think this shows the value of doing these types of studies where we'd expect disease exposures to be different from site to site across multiple sites. So trial 2, even more obvious. So again, we see, out of the 7 sites, we see a bulk majority of those. Again, we see an impact on pigs that were not vaccinated. So again, our subclinical type infection with PCV2, we did not have, in those pigs that weren't vaccinated, we did not have overt clinical signs of PCV-AD, but we did see poorer performance and higher mortality in those pigs that were not vaccinated. But again, as you look, so most of our sites in that case, but then as you look at these other ones, our interpretation from these 3 sites right here would be a lot different from these other 4. So we're able to capture a lot of the variability and disease exposure from site to site with these types of larger field trials. So in summary, one that everyone here is probably well aware, so PCV2 vaccination did improve growth performance and reduce mortality. But a couple things that were really important for us to see from this is what the subclinical impact on unvaccinated pigs is housed with vaccinated pigs in this case. And again, reduced performance without clinical expression of PCV-AD. And then the important point from, I think, an experimental design standpoint is we saw significant variability from site to site on that response. And the question is, why was this the case? Could be varying disease exposures, level of PCV2 shedding at those sites. We don't know the answer to that, but what we do know is it was important to conduct this study across multiple sites so we have a consistent answer. So I was going to wrap up with that. I think, just in summary, putting science into practice, I think a lot of the presentations we're seeing today, certainly the 2 major presentations here this morning are showing us that there is huge value to that. We have new and emerging pathogens all the time, PRRS, PCV2, PED, SVV as the last session in here, and I think it's important for all of us to realize that science-based practice, as we've had for all 5 of those diseases listed up there, will continue to lead our industry in the right direction and get the answers that we need to address some of these upcoming challenges.